All right, today we're going to be specifically looking at three different injuries that can happen in the sport of football. We're going to go into some definitions, some assessments, treatments, mechanism of injury, some rehabilitative exercises that you can do to get back into the sport. And hopefully, the intention of this video would be to instill some sort of increased confidence in the parents of the children who want to play the sport of football, in the trainers and in the coaches concerning their competency, um, and then hopefully creating more of a safe and more easygoing atmosphere where the parents will actually trust, um, not only the sport but the coaches and trainers that are teaching their children. All right, there are some factors that can play into injury in football, as with every other sport. Um, but with the youth and football, some things to think about could be immature musculature, immature bone structure, previous injury, improper warm up, um, improper use of equipment, whether it's too big or too small or they're not tightened enough. Wet or slick surface, say if it rained or if it snowed the day before and the field's covered in water. The nature of the sport alone, football is a dangerous sport. It's not so dangerous you shouldn't play it, but it is one of the more physical sports. Body composition in youth can vary greatly, whether it's weight, fat mass, bone mineral density, and then of course fitness levels. Some kids are simply in better shape and know how to handle certain motions and movements better, and they are less likely to improperly move their bodies and injure themselves. Now, our first injury is an ACL tear. First of all, the ACL, it's a ligament that it's in the knee, and it crosses from the underside of the femur to the top of the tibia. So the ACL, or the anterior cruciate ligament, is really a key stabilizer for your knee. And what it does is it guides your tibia through a normal, stable range of motion. Now, the ACL is very strong. The ACL is about as thick as your index finger, and it can actually carry up to about 500 pounds of force. So super strong. But an ACL tear or a sprain is where there's an overstretching or a tearing of the ACL ligament in the knee. And again, the tear could be either partial or complete. Now, let me give you some examples of some mechanisms of injury for an ACL tear in football. First, you can think of a receiver changing direction, stopping suddenly, slowing down while running, perhaps landing from jumping to get the ball. All these changes of motion and speed can all contribute to that injury, as well as a direct impact, from say being tackled or from being landed on by a defender as a running back or a receiver. What's really happening is you have this dynamic valgus stress, as you see right here in this video. The hip rotates internally, the tibia rotates externally, and you get that pressure going in both directions, which of course leads to that tearing or that strain that you see right there. All right, so we've gone over some of the anatomy in earlier slides. As far as assessment, you will have swelling and most likely some muscle tightness and some guarding. But there are a lot of tests you can do to look for ACL tears. The most common one and the most popular one is a positive anterior draw test. This is where you'll sit on the foot, knee bent at 90 degrees, and you'll pull anteriorly on the tibia and fibula. And if there's any movement where those two bones track forward as the femur stays in place, then that would be a positive for the anterior draw test. Treatment for an ACL tear, immediately going into RICE, rest, ice, compress, and elevate. ACL tears can lead into surgery. It depends on a lot of factors, whether it's the age or type of stress applied to the knee, the amount of instability that was already present or now present, and then of course just the techniques that are available to the surgeon at the time. They may or may not choose to do surgery at all or a different type of surgery. Surgeries can be complicated. Typically what they'll do is they'll take a piece of tendon elsewhere, whether it's the patellar tendon, which is most common, or they might take a piece of the tensor fasciae latae or the semitendinosus and then move it and reconstruct the ACL with that. With that, you're going to have a brief hospital stay. for about a week of wound protection. Then you're going to have 3 to 5 weeks in a brace, and then you're going to do some rehabilitation exercises for typically 4 to 6 months, of course, depending on the factors that I mentioned a minute ago. Let's get into one exercise that can help strengthen the ACL. All right, one exercise that you can do for an ACL injury is an isometric quadricep exercise. What you'll do is you'll roll up a towel here, place it under the knee to where the knee is slightly flexed. So for about 5 to 10 seconds, you're going to extend the knee, and then after the 10 seconds, you're going to relax for 3 seconds, and that's one rep. You'll want to do anywhere from 10 to 20 reps, and that'll be one set, but that's good enough. 20 of these for 10 seconds is plenty for the knee, and you could do that once a day, about 4 days a week. And then, of course, to make that harder, you could always put on ankle weights or hold the pose for longer. All right, the next injury is a meniscus tear. The meniscus there's two of them in each knee, and there are C-shaped discs that cushion between the femur and the tibia. These can be injured through valgus or torsional forces as you're playing your sport, and those, as you see in the diagram there, the meniscus has torn in the center there. All right, mechanism of injury. We've got traumatic injury, so of course a tackle or maybe a dog pile or getting fallen on there, sudden twisting motion or repeated squatting, or perhaps a twisting or a change of position on the weight-bearing knee. Those are all mechanisms of injury for a meniscus tear. Now, there are two meniscus in each knee, like I previously mentioned, the lateral and the medial. The medial one is more likely going to be injured most of the time. This is because it's attached peripherally to the tibia via the coronary ligament, so it's got less movement. It's got less give when you're bending your knee. There's 5 kinds of tears. You saw those on the previous slide: longitudinal, bucket handle, flap, transverse, and horn tears. As far as assessment, the trainer or the therapist would palpate along the joint line, and they would apply varus or valgus stress to the knee. They could also feel for crepitation, so for any crackling or any pain, and then they could also have them do a squat. If they're unable to do a squat, if there's pain or if it clicks or if it's locking at any point, then that could also be positive for meniscus tear. One exercise that you can do for a meniscus tear could be the heel slide exercise. This is where you'll be sitting on the ground, and you'll take the injured knee here, and you'll start out from about this position, slightly flexed, and then you're going to dig the heel into the ground, and you're going to drag your heel and flex the knee this way until you get to a fully flexed position, as much as you can go. You'd slide your foot back down, and that's one. That's one rep. You do this heel slide about 8 times, and you do 3 sets of that. What you're doing is you're really working the hamstrings. You're pulling the leg in, and by dragging the heel, it's putting a little bit more of a stress on the structures of the knee, so it's going to strengthen the ligaments and all the tendons and everything. It's in the entire area of the knee. So it's not just going to strengthen the meniscus. It's going to strengthen really everything in the knee, just from having that slight bit of stress there. Of course, to make it harder, you could always put on ankle weights or more reps, and that would be just one exercise for the meniscus. Okay, torn hamstrings. Torn hamstrings is when there is an excessive amount of stretching or tearing to either the bicep femoris, the semitendinosus, or the semimembranosus, where you see the muscle fibers in those muscles stretching too far and potentially tearing there. Hamstring injuries are pretty common in all sports, football included. Treatments for a meniscus tear, a little difficult on this one. Oftentimes you're going to need surgery. If surgery is not needed, there are some exercises you can do to strengthen the knee, in turn the meniscus, and that'll allow it to heal, but surgery is needed quite often. And as far as the tears go, if it's in an area that has good vasculature or even lesser vasculature, but it still has blood flow, it has a higher chance of healing. But if it's in an area where there's a lot of avascularity, where there's really not that much circulation, it's not going to really heal itself. And so that's where you're going to see a lot of the surgeries come in. And then after surgery, you're going to be able to put partial to full weight eventually at some point, full weight bearing with crutches. And you'd be on crutches for a little bit at first, and then after the surgery as well, you're going to be wearing a knee brace for 5 to 6 weeks just to keep the knee um, immobile. Of course, as you exercise, you can bend it a little bit, but it's not good to have that thing swinging all day long. It's you want to exercise it and then rest it. And so let's go into an exercise that we can do to strengthen the knee that could in turn help out the meniscus. Mechanism of injury for a hamstring tear in football. We're going to be looking at more of the sprinting, the jumping, and the heavy loading, or excessive force that's exerted on the hamstring, perhaps during sprinting, where you'll have an eccentric hamstring contraction, and on that initial heel strike, you'll get that excess stretching for the hamstring tear. With the tears, you have grade 1, grade 2, and grade 3. Grade 1 is where you'll have tenderness where the muscle tore. Grade 2 would be where you would have tenderness and some bruising. And then grade 3, you'd have lots of bruising, and you would actually see a tear, a separation in the muscle. All right, so we've gone over a bit of the anatomy of these three muscles. These three, the biceps femoris, the semitendinosus, and semimembranosus, are posterior muscles that are in charge of flexion of the knee. As far as assessment for hamstring tear, um, straight leg raise, which is what you see in the picture there, pretty straightforward. The trainer would lift the leg up, hopefully 80 to 90 degrees, but of course if it's torn, you're not going to get to that 80 or 90 degrees. And that would be a positive test for that. Resisted knee flexion, the trainer would provide some resistance while the patient would try to flex the knee. And of course, pain in either of those tests would be positive for a hamstring injury. Other things you could do, I mean, they're pretty visible. You could see swelling, you could see bruising, and oftentimes you can even see the hamstring balled up in one end of the leg. Hamstring tears are a little bit more easy to spot than a lot of other injuries. All right, so some treatments for a hamstring tear initially would include RICE, rest, ice, compress, and elevate. You could use NSAIDs or analgesics as needed for pain, but it's really important that the person doesn't return back to any activity until the function is completely restored of the hamstring. Um, for other treatments, you could do some isometric exercises, some cryotherapy, ultrasound, um, gentle stretching, of course, progressing as you heal, more and more stretching, jogging, stationary cycling, things that are a little bit lower impact on the knee, swimming, um, muscle rehabilitation after the injury. So after a while, in fact, should emphasize eccentric exercise, but of course not too much force. And then why don't we get ahead? Why don't we go ahead and get into some exercises to strengthen the hamstring? All right, one exercise that you can do for a hamstring tear could just be body weight squats, excuse me. And this will be done 3 sets of anywhere from 8 to 10, I don't know, 3 to 4 days a week, if you will. And this is simply just doing a squat with your body. And obviously, to make this harder, you could hold weights, on your shoulders. You could do dumbbells. You could even have a barbell on your back. You could obviously hold weights down here. There's a bunch of ways you can add weight. You could wear a weighted vest, etc.